Greetings, everyone. Welcome to my poster presentation. I'm Skazo Edward, a medical doctor by profession, and I'm affiliated to Copperbelt University under the Master in Public Health. So my title is Factors Influencing the Prevention of Malaria in Pregnancy in Zambia. That is a case study of Shiwangandu district in Muchinga Province. Introduction: Malaria remains endemic in Zambia, contributing to maternal and neonatal complications. This is despite the national strategies to eliminate malaria that was launched in 2017 to 2021. The objectives are to assess the effectiveness of malaria prevention measures in pregnancy and also to analyze the prevalence trends, evaluate knowledge levels, and assess the prevention practices and systemic challenges. So a cross-section mixed study was done, and 323 pregnant mothers were enrolled with 10 health workers. Data was collected using the questionnaires and also the group interviews. The analysis was done using the STATA and also the thematic coding. So from this study, key findings were that malaria in pregnancy was still prevalent in Shiwangandu, with about 14% in 2017 to 2021, which showed a slight drop in 2022, but of course it rose in 2024, about 14%. The knowledge levels highlighted that the majority of the mothers were knowledgeable about malaria in pregnancy, of course highlighting the causes as mosquito bites, of course, which was true, but this was also accompanied by some misconceptions where people attributed the causes to rain and also witchcraft. The other complications, the knowledge about complications was good, as most of them attributed malaria to causing miscarriages, maternal death, and also anemia in pregnancy. Prevention practices, most of the mothers were knowledgeable about fancied administration, and most of them had 3 doses, more than 3 doses, and those who had more than 3 doses demonstrated a higher knowledge about the prevention of malaria in pregnancy. Of course, most of them attributed, also gave a highlight of the use of mosquito nets and also house spraying using the indoor residue spraying method. Systemic challenges were there, especially among staff. Staff were knowledgeable about malaria in pregnancy, the treatment and the prevention, and what was found were that there were cultural misconceptions that were hindering the uptake of Fancida, the nets, and also the spraying, stockouts of Fancida and ITNs, irregular spraying, and also lack of water and caps to do the direct observed therapy of Fancida. In conclusion, we could see that there was high awareness, but gaps and misconceptions persist. There were systemic issues which limited the intervention and effectiveness of the prevention measures that were put in. There was need to strengthen health systems and community education. Recommendations are that to improve supply chain and infrastructure, conduct longitudinal studies on Fancida outcomes, preventive outcomes, and also enhance community awareness and engagement. The other one was to integrate malaria prevention into regular and routine antenatal care services. Here ends my presentation. Thank you.